the Overman Warrior Podcast.
Hi, it's Rich Hoffman here. I think it's important to kind of reflect on the glee that was obvious from some members of the media community on the New Glenn explosion. The hopes, you hear the same thing every time there's a death of a celebrity that is announced. One that comes to mind, which wasn't really a celebrity, but people who know well, Marcia Lucas, George Lucas's ex-wife, recently passed away. And there's always, especially when they pass away of cancer or some sort of terminal illness, when you get a diagnosis, as Pam Bondi did recently, there's almost a tongue in a cheek, and I talk about it. It's a psychological mechanism that the same kind of people who tend to be socialists and Marxists or lean Democrat, big government services, big union labor, tend to like it when lofty personalities are grounded by terminal illness. You really hear it when you get a cancer diagnosis, as we did with Pam Bondi recently, after she left the Department of Justice, and she was diagnosed with thyroid cancer. When that cancer finally catches up and the person dies of the illness, there's almost a glee in the people who report its voice. And I certainly heard that with Pam Bondi. Oh, the lofty Pam Bondi, a member of the Trump administration, has been diagnosed with cancer. Tongue in the cheek. Same kind of glee that you saw with the New Glenn rocket explosion at the Kennedy Space Center recently. Oh, all those lofty pursuits to go to space. Grounded, blown up. All the lofty ambitions that humans have been grounded. Let me tell you something about cancer diagnosis, and I know this for a lot of reasons. I have family members who work in the medical profession, and to be honest with you, I can't stand the medical profession. I think the medical profession, when you hear Amy Acton out there saying, "Oh, the nurses were there for everybody," you know what? There is no larger group of people that cheat on their spouses more than nurses in hospitals. I guess if you change a lot of bedpans and you're taking care of a lot of people in a depleted state and you're looking for a little juice to your life, an affair with somebody, because you interact with a lot of people who are in vulnerable positions as a nurse, an affair with somebody might be very exciting. But I find that the general hospital care, and when I've had family members who have been in the hospital, I despise going. I despise the smell of the places. I despise the people who work there. I don't think the way we've designed our medical profession has been good at all. And I would point to the same kind of elements that with space. Why do I like space so much? Well, I like the innovation that comes with space. I like the offshoots of technology that develop because of space exploration. And when you have the right stuff is that perfect balance of analytical analysis with devil may care adventure of pushing the limits to see what you can get away with. When those things come together, you get the right stuff. And most of our human cultures don't have anywhere close to the right stuff. I loved the Tom Wolfe book when I was growing up as a kid. I read it extensively in my grade school years. And I love the movie, of course. But the right stuff, what's the right stuff? You need the right stuff, I've always felt, in the medical field. We have the wrong stuff in the medical industry, and that is subservience to illnesses of all kinds. You have the Amy Acton types out there in the world. Amy Acton, the crazy old hippie type that's running for governor in Ohio, that want to shut down, have lockdowns, go out there parading around nurses as if they're the greatest thing in the world. And these are the same people who are like, hey, you know what? Pam Bondi has cancer. Oh, all those lofty personalities that you think are in the Trump administration or those celebrities, death gets them too. So come to our union organized labor movement at the hospitals. Throw money at this ridiculous medical care industry where that has a lot of Medicaid fraud, because anytime you have money exchanging, where people are willing to pay just infinite amounts of money just to stay alive a little bit longer, fraud is a natural byproduct. Throw endless amounts of money to our Obamacare systems, where all these medical professionals that we're supposed to celebrate like they're in the military, defending the Constitution. Now they're keeping you alive, they say to you. Oh, so-and-so just got diagnosed with cancer. See, nobody escapes. You think you're going to escape too? Ha, yay, someone got cancer. Lofty personalities are going to have to come to our hospitals and be cared for us eventually. Nobody escapes. That's why there's a tongue in the cheek when they announce these cancer diagnoses of personalities that are celebrities, or big personalities that are part of a big political order. There's often a celebration that lofty personalities are grounded like everybody else. Nobody's better than anybody else. And that roots out a Marxist element that resides in the background of polite society. And I think it's disgusting. I don't like it. I don't like the medical field, the way it's been designed in human culture. I think it needs major reforms. And I'd go as far as to say that people know right now that there's cures for cancer. We know how to defeat cancer. We're supposed to have defeated cancer during the Biden administration. But and with Trump, you expect cancer any day to be announced as a thing of the past, just like any illness. I think cancer should be designated like a cold. You wouldn't go out and make a media announcement, oh, so-and-so has a cold. That's what cancer really should be in our society. It should be easily preventable, beaten. I think we have a pretty good idea how to do that now. It doesn't need to be a killer diagnosis, but the people who want to keep it that way are those who want you to throw endless amounts of money at the healthcare industry because it's an easy living for them. And they like the idea that people, personalities, lofty, haughty types can't escape from it. There's actually a little silent celebration. And if you've ever been around a lot of nurses, you know the type. And yeah, they're a little on the wild side because they see the worst in human beings. So they look for some, they tend to be have an association with bodily pleasure. That's what makes them candidates for affairs. And when you look at the demographic population and those who have more affairs than other kinds of people, you'll find the nursing profession produces a lot of people that go out and have a lot of affairs. And it comes down to not being very lofty personalities. That's the kind of people we attract to our healthcare industry. Compliant, safety tyrants who trust the process that as it's been invented by health insurance agencies, and they find their groove in it, and they find they make disproportionate amounts of money because medical industry pays a lot, and it's an easy buck for most people who live and work in that field. They get paid more money than they deserve because it's a scam designed by people who throw money at it in order to stay alive a little longer. And what validates their cause is every cancer diagnosis. And I would say that I know it's done. The way to fix people, stem cells. I keep saying death is going to be an option just a few short years from now, 2026, where nanobots will be able to repair anything you have. And cancer can be easily destroyed from the outset, no matter what stage of cancer it is. Cancer should not be a death sentence in an advanced society. It should be a diagnosis, just like saying, hey, I have a cold. Oh, I got a bit of a sniffle today. Oh, I have cancer, stage 4. I'll get over it, be back at full speed in a week or two. That's how we should behave. If you want to have an advanced culture, cancer diagnosis should be like the common cold, not with a tongue in the cheek and saying, hey, some lofty personality is going to die just like everybody else. They put their pants on one leg at a time like the rest of us. They're no better than anybody else. And that's why that mentality, you see more people who cheat on their spouses. They cheat and have illicit affairs because they're not thinking in lofty ways about proper integrity as a human being. They're dirty. They urinate all over themselves, need bedpans. They see personalities that have made millions of dollars degrading in their hospital beds, and they're like, you know what? Why don't I have... Who cares about living a lofty life? I want to live for here and now and have fun. And that's a pretty cute guy that came in looking after his mom. I think I might want to have an affair with him. Here's my number. Here's how you can find me on Facebook. Let's talk about your mom while you're in a vulnerable state, and then pretty soon we'll be in the parking lot having illicit sexual activities. Oh, by the way, so-and-so has cancer. Everybody gets sick and dies of something. Isn't that great? See, nobody's better. Why try? Why try to be a better person? That's what I see when I hear people saying, oh, Pam Bondi has thyroid cancer. She's probably not going to live very long. Isn't that great? More people from the Trump administration are going to die off. Yeah, no wonder you have all these killers from the Democrat Party out there trying to assassinate Republicans. That's the kind of attitude. That's the kind of subtle... the people who hear me say that say, well, I didn't say that. You didn't say that. You imply it. You imply it by the way you say, oh, Pam Bondi has thyroid cancer. See, nobody escapes. Bring us money. Fund Obamacare. Nobody gets away from illnesses. And yeah, somebody died of cancer last week. Someone you probably know, some celebrity. So that means send us endless amounts of money for a healthcare industry that is broken at the core and has broken people running it. People who charge too much, do too little, and are not the kind of personalities that you'd want to trust your life into. Healthcare needs a complete reform from the ground up in its funding structure and what we expect out of it. And I would say right now, there are cures for cancer where cancer could be defeated easily. It's like the common cold. And we'll look back on it in a few short years and say, wow, why did anybody worry about cancer? But as it stands today, cancer validates a lot of worthless people in that field of endeavor. It gives insurance companies reasons to charge a lot of money and for a service that plays on people's fears because they're afraid they're going to die. And not all those funding models go away the minute you announce cures for cancer, which is why I say it hasn't been done yet. Stem cells are the way to cure most everything, including diabetes. These drugs, pharmaceutical companies have to change their funding models. Of course, they don't want to see it. They lobby hard on K Street to make sure that people stay sick and in a depleted state. And there's an actual joy every time there's a cancer diagnosis from those same kinds of people who say, hey, you're not too lofty to get cancer. You're going to die too, so don't be so high and mighty. Live while you have it and while you're young and have a young body. Enjoy it. And don't let values rob you of a good time. That's why you have a screwed up world. Because people stay sick and depleted and don't elevate themselves into lofty emotional positions because they're always looking over their shoulder for the Grim Reaper to bring a cancer diagnosis that the media will then announce to the world if they become celebrities of some kind. They'll lose their privacy. Or anytime you say, hey, I have cancer, your insurance company's like, oh, that's a dead person walking. Let's charge them a lot of money, or let's go after everybody in their family for a revenue stream. Let's capitalize on the misery as much as possible. That's why it's a bad thing. That's why healthcare, the way we've designed it, that's why Obamacare was a disaster, Medicaid was a disaster. That's why every politician is saying throw more money into that terrible system and at those terrible people who work in the field. Yeah, Amy Acton's an idiot for coming out and saying, "Oh, because I was in health, these nurses sacrifice themselves all the time." You know what? There's some of the most low life kinds of personalities that there are out there, and I say that knowing quite a lot of people who work in that industry, and I don't like them. I don't like that they're in the industry. I don't like that they're associated with it, and I'm ashamed of them being associated with it. That's why I have some of the feelings I feel about it, because I don't like the healthcare industry the way it's been designed by human beings. It's a scam at most levels, and the cures for cancer have been out there for quite a long time. And what's holding back that innovation? Those kinds of people, and that's why I despise them. Should be able to go down to Walgreens and get a pill that kills the cancer cells in your body instantly at this stage. And the fact that you still have people who say, "Oh, Pam Bondi has thyroid cancer," isn't that great? Another member of the Trump cabinet is going to die. We're happy about it. Keep coming to our miserable government-funded healthcare system that just keeps people sick longer and prolongs their misery so a lot of people can profit off of it. Enjoy your young body while you have it, because someday you'll be old and miserable and dying, and you'll pay your price. And lots of older people have paid their price, and they want to see young people as miserable as they were growing up. So they're not inspired to unleash cures for cancer that will disrupt the funding model of the structure the way it is now. That gives government a lot of power over people's individual lives. It has insurance companies dictating terms that make everybody miserable. That's why I say the healthcare industry is a joke, and anybody that facilitates it is actually knowingly inflicting harm on other people. And those cures are out there, and they don't want them coming out because it changes their easy lives, and that makes them very evil, and that makes the industry itself very evil. There's cures for cancer, and I would expect those cures to be announced during the Trump administration. This next 4-year term, I think it could be done today based on what I know of what's going on in the industry. And stem cells and nanobots and all of those are the future of healthcare, prolonging death as long as possible, and letting a lot of young loser types profit off of it for an easy living. I don't consider it to be something we should be funding at all through any means. Not one taxpayer dollar should go to a medical industry that's just prolonging the death of people, and it uses those negative stories that are common and announced all over the media to justify their racket on society in general. I think we should have actual cures where people actually get better. We cure diseases, cancers, depleted health conditions. We cure them and restore them back to a healthy body. That's the way the future of healthcare needs to look. And anything short of that is a scam perpetuated by worthless people that you don't want to perpetuate in a healthy society. Giving them influence over other healthy, righteous-minded people is not a way for a moral foundation for any civilization to function. That's why I don't like the healthcare profession at all, at any level. Nurses, pharmacists, people who work in selling insurance, people who sell life insurance. I don't like any of them because they leave looming in the background this depleted condition, and they do have a bit of tongue in their cheek when they announce a cancer diagnosis, because it means that people have to be afraid and use their services and throw money at their field of endeavor without thoughtful consideration, because no one wants to just die. You want to throw money at it, hoping that you can prolong that inevitable condition. Even though science has brought us to that precipice, the health tyrants don't want that to ever be known, so they continue to enact their racket upon the human race, which is what you saw in the diagnosis of the Pam Bondi cancer diagnosis of her thyroid cancer. It's the same kind of people that were happy to see the New Glenn rocket blow up on the the launch pad because they don't want to see a space economy change the funding models of their current tyrannies over the labor force. Space economy is going to open up all kinds of doors that have been closed for a long time, and I'm excited to see it. And there are people who are reluctant for that to happen, and they're happy to see something that might regulate the space economy out of existence, like safety tyrants who all of a sudden are afraid of every rocket explosion. Oh, something bad happened. Yay! Oh, Pam Bondi has a cancer diagnosis. Yay! We're happy about it. Keep throwing money at our government-funded Obamacare model that keeps people sick longer than they need to be so we can profit off their demise. That's what's really going on, and that's why they cheer. And it's sickening. Innovation is the way we should want everything to happen in an innovative way, whether it's space exploration or healthcare. Cures for cancer. Don't just worship at the idols of cancer as a sacrifice to the gods of antiquity. Cure it. Kill cancer. Destroy the cancer cells through innovation and technology. And I'd say a lot of people already know how to do that. And the reason we're not doing it now is because we're trying to keep this funding model going that puts a lot of money into the pockets of illicit people who don't deserve it. They're the worst of the human race. And they make easy lives skimming off the fears of people who throw money into the insurance bucket, hoping to, when their time comes, that there will be some money and some technology to prolong the inevitable so they can live a little bit longer. When really the cure has always been right in front of their faces and they just didn't have the guts to go grab it and use it. Because society tries to profit off the demise of the living for the perpetuation of their own essence. And it's an ancient sacrificial ritual that has found its way in polite society through various means. We just don't name them the way we typically have in the past. We call it other things these days. We can just name it insurance, and people who live off the insurance industry, playing off people's fears, and anything that might alleviate those fears disrupts the funding model, which they don't want to see happen. And that's why people, as many people that we have today, are so miserable because it is always an ill-conceived concept that kept the human race from expanding in proper ways into a healthy future. Keep people sick longer, and more people can profit off their demise. And that's a racket in every category that you can consider it. And Amy Acton represents the worst of those types of people. And every time I hear her come out and say, let's celebrate the nurses who sacrificed themselves to keep us all well. Nope, that's not what's going on. They're some of the worst people there are in the world. And it's not popular to say that because everyone's afraid that they're going to have to do a spell in the hospital. They're going to have to be cared for by those same types of people. So they don't have the guts to come out and say it because they just wait for their turn to hit the hospital bed and be cared for as a former lofty personality that has had everything robbed from them through depleted health. And nurses help bridge that gap. And everyone's afraid that they're going to have their stint with the nurse taking care of them, so they don't criticize them the way they deserve. And actually fixing people and making them healthy again is the way to fix it in the future. And that's where the future of healthcare resides. And we expect that to happen under the Trump White House. And it could have happened in past White Houses, but we're just now starting to talk about it. And Pam Bondi's cancer diagnosis for thyroid cancer isn't a death diagnosis. It's just it should be viewed as the common cold that can easily be destroyed quickly. Cancer should be a thing of the past with the technology of advanced society, which is what we're supposed to be. And the minute we do that, we can call ourselves an advanced society, but cancer shouldn't be killing people. And everybody who's sitting on the cures, knowing that it's just going to force people through the diminishing condition of degrading health and throwing endless amounts of money at that condition, know they're perpetuating a scam that is on its last leg as we speak, and I'm happy to see it. And for all the same reasons we want to travel to space and explore space and do great things in space, we want to do the same thing in healthcare. And a healthcare that does not restore people back to perfect health isn't really healthcare. It's just slowing down the rate of decay so health insurance companies and employees of labor unions can profit off that demise with a funding model that has a lot of government money attached to it. And the minute you end that, the better the world will be for everybody. And everybody will benefit from that change state. Anyway, Rich Hoffman here. Share, subscribe, make tomorrow a better day. If you haven't read my book, The Gunfighter's Guide to Business, I think you'll love it. Anyway, have a good day. See you later.
In the age of disclosure, you must understand the politics of heaven. Coming soon.
Coming soon, the politics of heaven in 2027. A treasure hunt through heaven and all human history.